Today, we will talk about indirect acting parasympathomimetics. Acetylcholinesterase enzyme is responsible for degradation of acetylcholine in the synaptic gap. And also pseudocholinesterases degrade acetylcholine outside of the synaptic gap. So normally acetylcholinesterase enzyme inhibit the effect of acetylcholine. They called indirect acting parasympathomimetics because they increase the amount of acetylcholine by inhibiting the acetylcholinesterase enzyme, not act like an acetylcholine as in the direct acting parasympathomimetics. Among the drugs in this group, if the drug pass into the central nervous system, it can be used in Alzheimer's disease, and if cannot pass, it can be used in myasthenia gravis. Let's talk about drugs used in the myasthenia gravis. These drugs cannot pass the central nervous system and reversibly inhibit acetylcholinesterase enzyme. Edrophonium. It is the shortest-acting anticholinesterase drug and is used to differentiate myasthenic crisis from cholinergic crisis. Neostigmine used in myasthenia gravis. It has a direct effect on the nicotinic receptors in the skeletal muscle. And also used in ileus and urinary retention. Distigmine. It is the reversible anticholinesterase with the longest effect. The most important neurotransmitter related to learning and memory in the central nervous system is an acetylcholine. In Alzheimer's disease, the amount of acetylcholine in the brain decreases. These drugs increase the amount of acetylcholine by inhibiting the acetylcholinesterase enzyme in the central nervous system. These drugs are tacrine, donepezil, rivastigmine and galantamine. They irreversibly inhibit the acetylcholinesterase enzyme by phosphorylating the serine region. They are generally war gases such as sarin and tebun and organophosphates such as ecothiaphate and isoflurafate. They are the longest-acting anticholinesterase inhibitors. In medicine, only ecothiaphate is used locally in the treatment of glaucoma. Pralidoxime used as an antidote in organophosphate toxicity because it reactivates the acetylcholinesterase enzyme. Increased secretions, bradycardia, bronchoconstriction and meiosis occur in organophosphate toxicity. Atropine is an anticholinergic drug. Physostigmine is a centrally acting anticholinesterase and also used intravenously in atropine poisoning. The first symptom in atropine poisoning is dry mouth, followed by body temperature elevation, tachycardia and mydriasis. Physostigmine is also used in glaucoma. As a conclusion, if the drug pass into the central nervous system in this group, it can be used in Alzheimer's disease. If cannot pass, it can be used in myasthenia gravis. In Alzheimer's disease, tacrine, donepezil, rivastigmine and galantamine are used. In myasthenia gravis, edrophonium, neostigmine, distigmine are used. Organophosphates irreversibly inhibit the acetylcholinesterase enzyme and in toxicity pralidoxime used. Atropine is an anticholinergic drug. Physostigmine used in atropine toxicity.